Hey guys, I'm going to share 7 strategies for preventing heart failure and actually supporting overall heart health. Alright, so first up, let's talk about vitamin D3. This is actually a hormone that plays a crucial role in heart function. See, there was a large study by the University of Kansas found that people with heart failure who had the lowest levels of vitamin D were more than twice as likely to die from their heart disease compared to those with higher levels. There was another study in Germany gave heart failure patients either 2,000 international units of vitamin D3 per day or a placebo. And just after 9 months, those taking the vitamin D had significant improvements in their heart function. Experts now recommend that older adults should get around 5,000 international units of vitamin D3 per day for optimal health. My recommendation based on years of experience and catering for many patients, 1,000 IU per 25 pounds of body weight is ideal in the summertime and 1,500 international units per 25 pounds of body weight in the winter season. Moving next to statin drugs. Now, while they can be life-saving for some people, they do come with multiple risks. Statins work by inhibiting an enzyme that produces not just cholesterol but also coenzyme Q10. And coenzyme Q10 is critical for energy production in your heart cells. A study from Columbia University found that taking statins can actually lower your coenzyme Q10 levels by up to 40%. And that's why it's important to supplement with coenzyme Q10, ideally in a more absorbable ubiquinol form. If you need to be on a statin, aim for around 100 to 300 milligrams per day of ubiquinol with food. Now let's chat about omega-3 fatty acids. Now these healthy fats are technically powerhouses for heart health. The two key omega-3s are EPA and DHA, which are found primarily in fatty fish. Now, a massive study called GISSI Prevention trial followed over 11,000 heart attack survivors. They found that taking just 1 gram of omega-3 per day reduced the risk of death by 20% over a 3.5-year period. Eating fatty fish like wild salmon at least twice a week can help you get enough omega-3 fatty acids. If you opt for a supplement, choose one with high DHA content and intake of 1 to 2 teaspoons daily. Another factor that's often overlooked is the role of exotoxins in heart health. See, these are substances like monosodium glutamate (MSG) and aspartame that overstimulate your cells, potentially leading to cell death. Your heart actually has glutamate receptors similar to those in your brain, making it susceptible to exotoxic damage. There was an animal study from the University of Toronto found that applying MSG to heart cells caused oxidative stress and impaired heart function. And the best way to avoid exotoxins is to minimize totally processed foods and focus on whole food sources of protein and nutrients. Great supplement to detoxify these would be NAC, and acetyl-L-cysteine, of 2,400 milligrams every 3 hours, or reduced glutathione of 2,000 milligrams every morning for 5 days and recycle. Now, speaking of nutrients, many people with heart failure are deficient in key vitamins and minerals. One study looked at 30 patients with advanced heart failure and found that 100% were deficient in selenium, 50% were low in zinc, and all had very low levels of vitamin D. Other common deficiencies include magnesium and B vitamins. Now, taking a high-quality trace mineral supplement can help ensure you're meeting your basic micronutrient needs to support heart function. I also recommend looking for one with activated forms of B vitamins like methylfolate and methylcobalamin. Mercury is another often overlooked risk factor for heart disease. A Finnish study followed over 1,800 men for around 13 years, they found that those with the highest levels of mercury were over 60% more likely to develop heart disease and 68% more likely to have a heart attack. See, mercury can come from a few different sources. Silver dental fillings are about 50% mercury and consistently release mercury vapor that can be inhaled. Certain vaccines, like some flu shots, also still contain mercury preservatives. Finally, some type of fish are high in mercury, especially larger predatory fish like swordfish, shark, and albacore tuna. It's best to choose much smaller, lower mercury fish like sardines, anchovies, and wild salmon. You do have mercury fillings, consider have them safely removed by a biological dentist. Lastly, we can talk about heart health without mentioning stress. See, chronic physiological stress can be just as damaging to your heart as physical stress. See, when you're stressed, your body releases hormones like cortisol and adrenaline. And over time, this can lead to inflammation, high blood pressure, and of course damage to your arteries. There was a study from Harvard found that people with the most work-related stress had a 50% higher risk of developing heart disease. So managing stress through things like exercise, grounding, time in nature, and nurturing relationships is so important for keeping your heart healthy. In addition, I do highly recommend the usage of L-theanine anywhere between 200 to 1,000 milligrams daily on an empty stomach. So to sum it up, if you want to give your heart the best chance at staying strong and healthy as you age, focus on these 7 strategies. 1. Optimize your vitamin D3 levels through safe sun exposure and supplementation. 2. If you need to take a statin drug, make sure to also take coenzyme Q10, ideally ubiquinol. 3. Eat plenty of anti-inflammatory omega-3 fats from fatty fish or supplement. 4. Minimize exotoxins like MSG and aspartame by focusing on whole, unprocessed foods. 5. Make sure you're getting enough heart protective nutrients like magnesium, selenium, and B-methylated vitamins. 6. Reduce your exposure to mercury from fillings, vaccine, and high mercury fish. And 7. Make stress management a priority through lifestyle practices and self-care. Now, I know that was a lot of information, but I hope it helps paint a picture of how you can support your heart health naturally. Remember, even small changes can add up to make a big difference over time.